Hello everyone, I'm Dr. Robert Shapiro from Shapiro Holistic Health and Chiropractic, and today I wanted to shoot this video to highlight a product that I've been using in my functional medicine practice for a while now. I was introduced to it probably a few months ago, and I had actually been using something along the same lines as it. That product is called the IgG Protect, but sometimes the problem I was running into with IgG Protect, because it is a dairy-based product, I was having still some people that were extremely sensitive to dairy. They were having still some slight reactions to it. So nice thing, along came this product called SBI Protect right here. And so we really kind of want to highlight that for you today. So kind of getting into this thing, what it is it is an immunoglobulin G-based product. Now, what is that? Well, immunoglobulins are proteins that your immune system synthesizes in order to bind to certain pathogenic or disease damage-causing microorganisms, allergens, and toxins. And so they will bind to these things and render them basically neutralized. And either your immune system will destroy them, or you'll pass them out through your gastrointestinal tract. Now, your intestinal tract is always inflamed to a certain extent, and some inflammation is good, but unfortunately, in our modern society, we are constantly bombarded by various sources of irritation, toxicity, and pathogenesis. So got all these bugs that we're being exposed to. I mean, you see it on the news all the time. You get these food outbreaks of listeria, E. coli, C. difficile, and so we are being bombarded by this stuff pretty frequently. And to an extent, it naturally exists inside of us anyways. But many times our defenses will get compromised. So whenever somebody comes in with conditions that I suspect might be helped by this, well, number one, the first thing I want to do is I want to make sure that they're addressing their normal everyday diet. And I want to make sure that they're removing offending foods and that they're adding in complementary foods. So foods that are complementary and gut healing are going to be your fermented foods like your sauerkrauts, your kimchi, your maybe kefirs, even kombucha. Those are nice ones. Just pretty much any vegetable that you can ferment and jar. That's going to be beneficial to you. Although it can be hard to kind of find that in grocery stores, you can make it yourself. Cabbage, believe it or not, like cabbage soup, is very, very beneficial to healing the intestines, and so that's another good food. But sometimes people are so depleted and so inflamed, so damaged, that changing the diet is not going to do the job. And so, in those situations, maybe I might have them introduce like some bone broth if they're not already doing it, but they may have to move to one of these types of products right away to really get the inflammation and the damage under control. And so the cool thing about the IgG products is that they bind to the bugs and to the toxins, and they render them defenseless. They render them inert or incapable of causing further damage, and they allow the gut lining to heal itself. They give it time to heal itself and to fix all the breaches that are in it. And so what I mean by breaches is the technical term for that is called intestinal hyperpermeability. The layman's term is called leaky gut syndrome. And so what will happen is things will damage the intestines, inflammation, all that stuff, and you'll get gaps in between the cells that line the intestine. And so those gaps create doorways for things to come in that shouldn't be coming into your body, into your bloodstream, and then getting to other places and causing systemic inflammation and systemic reactions, and potentially leading to autoimmunity. And I'm going to get into that in another video. So in that case, if we use these IgG products, we can bind up these toxins and irritants, and we can allow the body to heal itself. Now, for the person that can't that has very little tolerance for dairy-based products, then they'd want to go to something like SBI Protect right here. And this one, they've removed all the dairy out of it, and it's the pure. Essentially, these come from colostrum. That's really what they come from. That's what they're derived from. And so they just they purify it, and they make it to where it's only the IgGs in it. Here's a little product sheet on SBI Protect, and it shows you the clinical applications. It provides concentrated immunoglobulins to enhance gut mucosal immunity, and that's actually also the respiratory system too, by the way. It enhances respiratory immunity. Helps maintain microbial balance. Your mid to lower gut is full of bacteria, ideally beneficial bacteria, but unfortunately there are some opportunistic microorganisms and some pathogenic ones like C. difficile and E. coli and Candida albicans. And so this helps to bind those pathogenic organisms and render them non-harmful, and then allow you to pass them out or destroy them. Supports GI barrier health and integrity. Again, going back to what I was saying, leaky gut, intestinal hyperpermeability. This gives the body time to heal itself, because if it's constantly having to deal with these microorganisms, then what it's doing is it has troops. Your immune system's there, constantly throwing grenades into the gut, the gut space. And this is causing massive amounts of inflammation and damage. When you render these things basically incapable of doing anything to you, then the immune system no longer has to wage war. And so the fire dies down, the village gets to heal itself, the lining of the intestines, it heals itself. Helps maintain normal inflammatory balance. I just was describing that, so basically that's what it's referring to. Now, interestingly, this product was originally released as a medication, as a drug, and the name of that medication is called Interrogam, and it's only available to GI medical doctors, and it's $500 a month cash for a month's supply. This company, Orthomolecular, they got the rights to the patent of this nutrient, and they created this product out of it. And they've released it under this name. Most people have no idea that they're exactly the same, that Interrogam and SBI Protect are pretty much exactly the same, other than Interrogam is tabletized and probably has some other ingredients to allow it to make it a tablet, maybe allergenic ingredients, who knows, probably not. SBI is just the straight powder, so it eliminates the potential of any kind of allergens or potential contaminants. And it costs about $120 to $130 a month to take this on a therapeutic dosage. What I mean by that is, initially you take about 5 grams a day. Once your condition settles down and you know the healing is underway, the recommendation is to cut it in half to about 2.5 grams a day. And for people who either have autoimmunity like Crohn's disease or ulcerative colitis, or maybe they have chronic IBS, they're probably going to want to have a maintenance dosage, either constantly or on and off, maybe month on, month off sort of thing. Most people, if they just have gut inflammation, once they're healed up, they probably don't have to use this. The other people that are going to want to use this are people who are recurring or chronic users of NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. The obvious examples: ibuprofen, naproxen, naproxen, aspirin. Anything that's an NSAID is going to damage the intestinal lining. It's going to lead to leaky gut hyperpermeability, and therefore you're going to need something to neutralize that damage, and always kind of going in and fighting fire with fire, if you will. Just actually fire with liquid carbon dioxide. That's the best example, or liquid nitrogen. Sorry, I'm kind of geeking out there. So, anyways, I just wanted to share that this product with you. This is what it looks like right here. And you see the picture there. And so anyway, I hope you learned something from this. I hope that this was valuable information for you, and I'll be try to bring you more good content. Here is some research right here from PubMed, and PubMed is basically kind of a repository for all research that's out there. And the reason why I'm showing you this is I'm not basing my stuff just on anecdotal in office, what my patients are telling me or what I'm seeing. This is based on scientific research. So if you're the kind of person that likes to look at this stuff, be my guest. For anybody that doesn't read research, I don't recommend it. You're going to get lost in the minutia. The cool thing about this study right here, it shows conferred protection against systemic infections by E. coli and Salmonella. And so this is what I was telling you. I mean, these pathogenic microorganisms can be very, very toxic, very damaging, and very persistent. And a product like this can help you get rid of these things and recover from these infections and other situations. So anyway, that's pretty much the end of my talk here, of what I wanted to show you. I appreciate you coming by, and we'll be seeing you in future videos.